Hello, everyone. It's Dr. Roy, hailing from Naples, not Naples, Italy, but Naples, Maine. I'm up at Lakeview upstairs. It's very hot, so I apologize if I look like I'm in a sauna. I feel like I'm in a sauna, but this is the quietest and best internet signal I could find, so here we are. And I apologize about the walls behind me. With that said, what I wanted to talk about today is the hygiene compensation upgrade. We've been working on this for the past several weeks. We've had a couple meetings. I've had many conversations with individuals. I think we have a very rich conversation about what we can do moving forward, and I just wanted to share with everybody what I'd like to do. So from a 10,000-foot view, we are hoping to normalize hygiene pay in the post-COVID era. COVID completely disrupted labor markets, and to the benefit of many labor markets, hygiene markets in particular, we have to make sure that we understand where the labor pay is in the hierarchy of labor markets. So before we get started on the action plan, I just want to talk a little bit about the current state of affairs, or the history of the current state of affairs, essentially just bullet points of where we are right now. So many labor markets have gone through significant changes over the past few years. We're all aware of this. Likewise, dental offices are having to be aggressive with pay bumps of their hygiene teammates. This is what we call supply and demand in the world of economics. This is supply and demand in action. 10 years ago, the supply of hygienists was very low. It was not uncommon for a hygienist to bring cookies with their resume 3 to 4 times a week. We are now in a low supply market. Therefore, it benefits you guys through increased pay. Likewise, the hygiene turnover is at the highest levels in history. This has been touted by many consultants, and this has only exacerbated the race north in compensation for hygiene. And also, the pay range of hygiene has narrowed considerably over the past few decades. And I'd like to take a look at that because that is relevant to the conversation. So this is my subjective experience. I can't say there's any hard data here. I like to be very discriminate when I share where I get data. This is just from my experience in the greater Portland area since 2010. I have friends that have hygienists. This conversation happens at many dinner tables, at study club meetings, so on and so forth. So I feel like I have a pretty good grasp on what the hygiene pay range was and is in the greater Portland market. And now I have a really good idea of actually all of Maine now that we've acquired some practices. So back in 2010, I heard of a pay range anywhere from $22 an hour all the way up to $40. There was quite a big range here, and that range was consistent with increase in experience, increase in services brought to the table from the hygienist. This was a pretty healthy range for a medical profession. But you fast forward to today, and that pay range has gone north, but it's also shrunk. And this is relevant. I can't say whether this is a good thing or a bad thing. This has happened in many industries as the labor market has gone through its changes. But when I say the labor range or the hygiene pay range has narrowed, this is what I'm talking about. Now, I don't know many hygienists that are making less than $35 an hour. Yeah, sure, there might be some outliers above $50, but for all intents and purposes, we're between $40 and $50 an hour. This phenomenon is a result of supply and demand forces, and not whether or not your dentist is being fair or not. So the conversation sometimes comes up that hygienists are upset about this fact here. This fact comes out of market economics and not necessarily something internal within your dental practice. So what are the goals of this proposal? What am I aiming to do? Well, first and foremost, I want SRD, Saco for Dentistry's hygiene compensation, to be converted from market competitive. We've been competitive. We've been above average for most of our existence, at least based upon my subjective experience, to a market leading level. And I'm going to share why I want to do that, and I hope everybody here is excited for this conversion. Another goal of ours is to increase the size of our hygiene team. Right now, our hygiene to doctor ratio is not where it needs to be. There's not enough dentistry feeding into the doctor's schedules. It's not from lack of patients, it's from lack of hygienists. So one of our goals here is to increase the size of the hygiene team to where we once were, to a comfortable level where we have everybody has a room 5 days a week. By providing a market-leading compensation for our current hygienists, we will be more successful in advertising for new hygienists. So this is one of our goals. In order to increase the size of our team, we need to pay you guys more so that we can offer more on Indeed. Additional team members will also free up Amy so she can continue to lead the team and advocate for you guys, but also free up Ray so he can focus on dental sleep medicine. Both Amy and Ray are very critical to the long-term mission of Saco River Dentistry, but they can only be in one place at one time. So if we add more team members, we can have these people doing what they do best. Another goal of this proposal is we want to make sure that we find a pay strategy or strategies that ensure and maintain a high level of teamwork, camaraderie, and patient care. Basically, we want to make sure that the culture that we've worked very hard to get to, where the team is a team and people get along, is maintained. I'm going to stand very steadfast that I'm protective of this because I'm very proud of the team of people that we have, and anything that risks that, we're going to shy away from. Also, we want to continue on improving COLI. It became very clear and evident through the conversations with you guys that COLI, for the most part, although not perfect, is beneficial for your compensation because it connects effort to reward. Right here, effort to reward. The harder you work and the better job that you do for your patients, the more you get compensated. That became very evident that that's what people wanted. They want to make sure that if they work hard, they're being taken care of, appreciated, and compensated accordingly. So I do think COLI gets us there, all while improving the quality of lives of our patients without the normal negative downsides of typical incentive-based programs. So here we have a hierarchy of different pay structures within the profession. Here at the top we have, we have pay range. This is current. Again, this is based on my conversations with my colleagues. Many conversations led into this data. Again, this is in Maine. So the public health, new practices, and other opportunities where maybe the employer can't pay a lot is somewhere between $35 and $40, maybe $41, $42 an hour. Then your standard dental practices, the Saco River Dentistries, the solo dental practices, are anywhere between $35 an hour and say $46, $47 an hour. These are offices with a benefit plan. Now, are there opportunities out there where you can make up to $50 an hour? Yes, but they often come without a benefit plan or a lesser quality benefit plan. I think everybody knows how I feel about compensating for retirement with the 401k match. I'm proud to say that there are not many, if any, dental practices that have a 4% match. Therefore, we are a dental office opportunity with a benefit plan, and I think a very good benefit plan. Have we been a little bit on the lower side with our pay per hour over the past several years? Yes, but we were building what we're building, and I'm very happy that we've gotten to a point where we can offer an opportunity here, and I call this the SRD Upgraded Hygiene Compensation Plan. So our goal here is to take the current pay range of the hygienists that are on staff, but also potential incoming hygienists, and give them the opportunity to earn anywhere between 40 and 50 plus. This needs to happen. The market has called for it. I'm not upset that we have to do this. I'm very understanding that market dynamics change with time, just been very rapid over the past couple of years, but here we are, to your benefit. So what I want to do is I want to try to create a compensation plan that gets us kind of in this range, and I'm going to share in a moment how we plan on doing that. What's the downside to this? Well, a few people brought up through the conversations that I've had with you guys, and this is not special to dentistry, but the concept of recently graduated individuals making as much or more than tenured employees within that market. We all know how upside down the traveling nurse conundrum has completely created a debacle inside of medicine. We're not that far from it with hygienists, and that's because recently graduated hygienists are making anywhere from $35 all the way up to maybe even $50 an hour. I can't affect that. So I know several of the people in this audience right now are upset about this. I'm upset about it too, because it doesn't do good for the profession when people without experience are making more than those with experience. But all I can say is we can focus on what we're doing in our four walls and make sure you guys feel well compensated for what you do. And I'm very proud of the fact that the structure we're going to create will keep you north of those recently graduated hygienists. But as we talked about, that zone has been narrowed. So you're going to have people recently graduating that find opportunities where they're going to make as much as you do. As much as it pains me to say, there's nothing I can do about that. All I can do is try to offer you guys a good culture, good environment, good facility, very strong continuing education program, lots of opportunities to grow within the profession, so on and so forth. I can't control what Dr. Smith in Portland pays his recently graduating hygienist. So I put this in here because it's the reality of the situation. Frankly, I think what we're offering is more than fair. It's actually above what you guys had asked for, and I think rather exciting to offer this to you guys. So here's the action plan. So with these goals in mind and the feedback that you all provided, here's what I propose. So follow me here for a second. So we're going to create a base pay of $40 an hour. But what we're going to do, this is the good part, is we're going to significantly raise COLI so the average SRD hygienist gets to around $48 an hour. What you guys had asked for was $46 an hour, but I think to be competitive within the marketplace and give you guys a buffer zone above and beyond what the recently graduating hygienists are making, I think this is a good number. How I'm going to get there with COLI is basically just going to be some math. I promise you guys that the average hygienist that's on staff right now will make an average of $48 an hour based upon your current day. To get there, we're not going to make you guys do anything above and beyond what you already do. But the compensation structure will entice you to be efficient with your time. We've already been doing that with COLI. So several of you had advocated for an increased size of the COLI pot. Exactly how we divvy the payment, so on and so forth, I have to figure out over time. But I promise you that this is going to end up with more money in your bank account at the end of the day without any change in effort. With that said, we want to create a good team, so I do ask that you guys increase your effort and always in continuing to be a good teammate. Several have asked that we add services to COLI to better reflect everyone's hard work in improving the quality of lives of our patients. Happy to do so. At the end of the day, I want COLI to benefit you, and I want the COLI program to benefit the patient. So far, so good. A few added services is definitely something that we can do. Then we advertise for hygienists on Indeed and other labor marketplaces in the $40 to $48 range. I'm scared of this. I'm scared because we're going to be advertising in a range that some of you guys might be making right now. I don't know how else to solve this problem because we are not going to get hygienists returning Indeed ad phone call or returning to reaching out based on Indeed ads if we don't get aggressive with this. So I apologize if this stings. With that said, this is where we're going to be. I have no doubt we're going to end up hiring a hygienist right out of school that isn't as competent as you guys might be. But that's where the COLI comes in. If they're not that good, they're not going to make $48 an hour. Some of you might make $50, $51 an hour, depending on how good and efficient you are with COLI. The point is the COLI is our differentiating factor. So we get everybody to $40 an hour. We may even end up paying the newer staff, the younger people, a base pay of $35 an hour with a COLI bonus. I'm not sure, but we're going to have to advertise in the $40 to $48 range. We're going to work really hard to make sure we don't pay them any more than you guys are. With that said, that gap is narrowed. So I'd love to hear what everybody thinks. I have spent a lot of time trying to hear everything that you guys brought to the table, coming up with an action plan that allows us to continue our mission at Saco for Dentistry without compromising the care, compromising our mission, compromising our culture. And I've talked to a lot of people about this too, and this is what we've come up with. I personally feel it's good. But before we launch it, I want your thoughts. I'd like to get this done within the next month. So I am currently advocating for a launch date of August 15th this year, where we restructure everybody's pay according to this new COLI program. In the meantime, I want to field any questions, thoughts, and concerns you have. Restructure the COLI program, talk about the frequency of the COLI payments, so on and so forth. So that's about it. That's all I have at this point. I ask that everybody understand there is no perfect answer that's going to make everybody happy. Trust me, if that situation existed, I would have definitely put that forward. There's only so much money to throw at problems in situations like this. But I do think that this is something that is above and beyond. It's above and beyond what you guys had asked for at our last meeting. And I think it solves most, if not all, of the issues and concerns that you guys have had. So with that said, thank you everybody for listening. I apologize that I had to use PowerPoint. It's how I express myself. It's how I get messages across. And I just felt like it was necessary for me to leave no stone unturned in this conversation. So I look forward to everybody's input. Please send me an email with your thoughts. Everything's great, everything sucks, somewhere in the middle, thoughts, concerns, questions, so on and so forth. I want to get this kind of squared away so that when August 15th comes, we're ready to go. All right? Hope everybody takes care, and I'm looking forward to getting outside of the attic. Have a good one.